Well, what's at stake for Pennsylvania kids if the Affordable Care Act is repealed? There's lots of activity in Congress about that. We're going to check in with Joan Benso about that. But first, the big stories of the week with two of the state's leading reporters. As they say, let's get to it.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Welcome back to the program. Well, there's a lot going on in politics and, of course, in state government, much less what's going on with the President of the United States and Congress. We'll pick up one piece of that when we talk about the Affordable Care Act, where in Congress they are discussing repeal and replace. But how about repeal and repair, something that the Speaker of the House has denied they're doing? But before we turn to that subject, I got Robert Swift. He's with Times-Shamrock Newspapers, and Karen Langley with the Pittsburgh Post-Gazette, two of the state's leading reporters. They cover all. You folks have to cover everything that goes on in the state capitol, don't you? The legislature, the governor, and we are, as this show airs, it airs at different times, a couple of days before what, Robert? What a big event.
This is the governor's annual budget address. It's the closest thing we have to a State of the Union address in Washington.
Good point.
Because policy gets mixed in with numbers that day. It's a joint speech before the House and Senate. And we find ourselves in a predicament that this state has had since 2009 of chronic revenue deficits. We're staring at a structural one of $3 billion, and the governor will propose something. Of course, it's up to the legislature to mold it.
Yeah.
And they'll have 3 weeks of hearings right after the address. So that this is what we face in the coming days. Now,
the governor has made it clear there's going to be no general tax hike. So, as Robert points out, it looks like, is it about a $700 million deficit in this year's budget, right, Karen?
Yeah, so even before talking about how to balance the next one that we're supposed to be now focusing on, they have to come up with a whole bunch of money to figure out how to end this one with the numbers even. But as you said, Terry, I think that this budget address will be a lot different than the first two that we've heard from the governor, because he's come out and said that he's no longer going to propose raising the sales or personal income tax rates, which before he'd said we had to do.
So they have to come up with $700 million. Now, there's another consideration, something like a $3 billion, what they call structural deficit. So you got the long-term debt, I think I'm right, $3 billion, the short-term debt, right, or I should say deficit of $700 million at least right now.
Not so much debt necessarily, but the imbalance between the continuing expenses and continuing revenues that the state can expect. But so there is this hole in the budget for the year we're still in, and then next year it's supposed to get even bigger, and together that comes up to almost $3 billion over the 2 years that you got to fill in.
Now, Robert, you've been through these before. Usually in the odd year before a presidential election, they might raise a big tax, the sales and income. But we're in the midst of a governor's race already, aren't we?
Right. It had been the pattern until maybe 2003 that they typically raise the income tax rate.
Yeah.
1 year they raised it and had to go back to the earlier level a year later.
Yeah.
But now we're in a different world.
I got to stop you here. They would raise it in a year before the election, and then it would be lowered automatically by virtue of the law, so lawmakers could run and say they did what?
They cut the tax.
They cut the taxes. Yeah, go ahead, finish your thought.
1992 was great, but now we're in a world where that has not been the solution to try since 2003. Now we're in niche taxes, one time of shifting money around different funds. We've had a wave of institutional closings, different years.
Yeah.
We've had education cuts. You name it, they've tried it, everything except for what used to be the standard income tax hike.
Right. Now, we're going to run to a break. When we come back, I'm going to talk to Karen about a couple of other things that have gone on, prison closings, department consolidations. There's a lot going on. Governor Wolf, I think, suggests that this is a way to save money. He doesn't want to raise the income or the sales tax, but as we point out, you got this imbalance in revenue and spending of about $700 million. We'll get to that after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, now celebrating 100 years as the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back to the program. Well, we're prefacing, if that's a way to put it, the state budget. Governor Wolf will deliver his budget message on Tuesday. That's February 7th to the legislature. That's his blueprint for the next fiscal year. I'm joined by Karen Langley and Robert Swift, two state reporters that cover what goes on in the Capitol and in politics. Karen, it looks like the governor, in the lead up to the budget address, has been focusing on closings, one prison, and I'll call it the reorganization, if you will, of agencies and departments in order, I guess, to save money, to take that.
That's right. So in the past few weeks, we've seen a few announcements about ways to restructure in some ways how some parts of government are done, and also to save money to try to cobble together, right, how to balance this budget.
Right.
So we had an announcement that the State Department of Corrections will close one prison, the one in Pittsburgh. For a few weeks, we had been waiting to hear which prison or prisons would close. They say that they can do that safely because the population's going down a bit. Mm-hmm. And then more recently, we had the announcement that 4 separate state agencies are going to be consolidated into one larger agency dealing with the health and human services functions of government. So like social service programs, drug and alcohol programs, that sort of thing. They say that they haven't said how much money that they think it'll save, although they say it'll save something. But this is being cast by the administration as a way to improve services.
Yeah. Doesn't seem, Robert, that's likely to save something like $700 million plus eat into the structural deficit that we talked about.
No, because one of the problems is in that regard, they're saying that they don't be nominal job losses. Mm-hmm. And typically, the greatest cost of government is salaries and benefits of the employees.
But they do have a hiring freeze, right? They
have hiring freezes on, but you look at trying to whether this can produce the kind of savings. And one of the other things I'm wondering about is all these agencies have, field offices in the different lawmakers' districts.
Yeah.
And so you start, because by nature you say, we only need one office.
Yeah.
What's the impact of that down at the district level?
Yeah. Well, and they're also, here we go again. We're debating the size of the Pennsylvania legislature about every year a bill comes up to reduce the size and they get optimistic about it. You'd have to change the Constitution. And is there anything else that either of you can mention in the legislature that they're likely to do that's of some importance? Either of you, anything that you've been following? Go ahead.
I think there's any number of bills that could come up again. One thing that we have seen the Senate take early moves on is the bill that deals with the statutes of limitations for child sex abuse. This is supposed to allow lawsuits and also a criminal prosecution for a longer period of time after the crime.
That's a great one. Yeah, what we're talking about here is to extend the statute of limitations for victims of child abuse from 30 to 50 years to bring civil cases, and I guess no time limit on criminal cases. Do I got that right? And that's a pretty big issue. Go ahead.
So there's a disagreement between the Senate and the House, and I think that hasn't been resolved yet. Okay. So we're still in that situation.
But that's an important piece of legislation. Anything else?
So the other thing they have to do is, or they still have, according to this year's budget, they're supposed to have an expansion of legalized gambling to produce $100 million. And one of the things he talked about is internet gambling. And apparently in the testimony before Congress, the Attorney General designate Jeff Sessions is an opponent of that.
Of internet gaming.
And that's federal law has played a factor.
But here's the point about this. They have budgeted slightly more than $100 million in revenues from this year's budget, in this year's budget, which is $700 million short, and they didn't do it, so there's no tax collected. They didn't do internet gaming. They're talking about slots in the airports, correct?
That's one of the things. And, you know, they had said that this was something that, because I guess it was mostly fee-based rather than tax-based, that it would be okay if they did it in the second half of the year. But now that, you know, it hasn't been done and we're getting to the next budget address, I don't know whether we're likely to see that, you know, during this fiscal year.
All right, thanks. Great update. Thanks for coming in. All right, what's at stake for kids if the Affordable Care Act is repealed? Joan Benso joins me, and we're going to take up that subject, and we'll do that in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit pacoalalliance.com.
All right, we're going to chat for a few minutes about the Affordable Care Act, but in a little different way than you probably have heard it discussed on national and on state news programs. Joining me is Joan Benso. She is the president and CEO of the Pennsylvania Partnerships for Children. All right, you want to talk about the Affordable Care Act in a little different way than we customarily hear about it. You want to focus for a few minutes on kids, children.
Yeah, I think many of your viewers and many lawmakers at times seem to forget that when we passed the Affordable Care Act, the impact in Pennsylvania was not just to provide health coverage to more adults and to allow for the expansion of Medicaid, which expanded coverage to 700,000 adults, and we think well more than 100,000 parents. But there are provisions in the Act that are specific to children. And as a result of it, Pennsylvania's rate of uninsured kids has dropped to the lowest number in years. So now about 4% of our kids are uninsured in Pennsylvania. And some of the reasons that happen are things like we no longer can underwrite for pre-existing conditions. So if a child has a debilitating disease, insurers now are finding a way to cover those kids when in the past they may have chose not to. Families faced very large cost sharing, often on preventive services, either for kids, which can be particularly challenging when you have a child, for example, on the autism spectrum disorder.
These are great points. In addition to that, you would argue that if they're going to repair it, we'll put it that way, replace and repair, they better be sure that they're taking the children's component.
Exactly.
And by the way, the whole business with, you know, the polls show this, pre-existing conditions, letting, students stay on their parents' health care till they're 26. We have a law, as you know, says they can stay till 29. But they're popular.
Use that one for example. So now kids can stay on their parents' health insurance till they're 26. In Pennsylvania, that insured 89,000 more young adults that were potentially still in school or working in, employment opportunities that didn't provide them health coverage. A piece people often forget about that component is it also extended Medicaid coverage to children who had grown up in the foster care system and came to adulthood and had no family. So those kids can now stay on Medicaid till they're age 26.
So, if we just extrapolate from this, this is a lot more complicated than you typically hear. And I'm not blaming the news programs. You know, you got a couple seconds in some cases to get this out. But what you're doing is providing some important context, I think. And there's also this business of streamlining. First of all, tell our viewers about the S-CHIP program in general, and then we'll talk about.
Well, I think one of the pieces of misconception about health coverage for kids in Pennsylvania and around the country is the notion that the vast majority of children are employed are insured under parental coverage. That's true for the majority, but in our state, which isn't a terribly poor state, which is good news, 40% of the children in Pennsylvania get their health insurance from Medicaid or CHIP. 1.2 million in Medicaid about 175,000 in the CHIP program.
And that was implemented by the late Governor Casey, if I remember that correct.
Pennsylvania was one of the first states. It was the second state in the nation to create a standalone health insurance program that sat on top of the Medicaid program for low-income kids. And in 1997, the federal government began to partner with the states. Now, Terry, you and I were here then, so we probably remember this.
I talked about that with Governor Casey.
Well, it was a great thing the governor, the late governor did, and I would say every governor since him has only done things to make the CHIP program stronger.
Regardless of party, let's get that out.
Absolutely.
It's not a party thing.
I stood with Governor Ridge when the CHIP program enrolled its 100,000th kid. And when the federal law passed, that gave Pennsylvania basically 66 cents on every dollar we spent, we had 45,000 children on the CHIP waiting list in Pennsylvania. They went away in a day. Another element of the Affordable Care Act is the match rate for the CHIP program. So right now, the match rate for the CHIP program in Pennsylvania is 90 cents on the dollar. So you were talking with Karen and Robert before about the grave financial situation our budget's in. The Affordable Care Act and our partnership with the federal government on Medicaid and CHIP drives an enormous amount of resources in Pennsylvania.
Your point is, if these go down and they want to keep this insurance coverage,
there's no way we can do it.
The burden would fall on the state, and it's not likely to happen.
And the other big issue that's being discussed, I mean, first of all, from our perspective, there are always ways to make any policy or any law better. And so lawmakers coming together in a bipartisan way to address the shortcomings that may exist in the Affordable Care Act is responsible.
All right, we're going to run to a break. When we come back, I know before I let you all out of the studio, I want to talk a little bit about pre-K, something that you also have an interest in, and we'll do that in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, advancing quality, improving lives. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
Final segment of Pennsylvania Newsmakers with Joan Benso. She heads the Pennsylvania Partnerships for Children. All right, let's talk about pre-K. We all recognize now, first of all, how important it is. All the studies have shown how important it is. We also know that it costs money, particularly if you're doing it in the public sector as opposed to, going to a church or a private enterprise. What's your sense about this?
Well, we're part of a group called the Pre-K for PA campaign that's been raising the visibility, the importance of this investment. And we're very proud of the work that has happened over the last few years. And you hit the nail on the head, Terry. We no longer are having a debate in Pennsylvania about, is pre-K a good use of public funds? Does it work to help kids get ready for school? Will it make a difference later in their lives? There's complete consensus on that. The question is, how do we scale it? And how do we find the resources to invest enough to, today in Pennsylvania, we have publicly funded pre-K through Head Start, federal funds, a state-funded Head Start program, and another state program called Pre-K Counts. And low to moderate income families can access this program. We serve 69,000 kids every day, but another 113,000 kids are eligible.
Yeah.
So it's going to take more than $400 million just to get to those kids.
Well, the long-term benefits from this are without doubt. I mean, the more you get kids involved in learning, the more they stay in school. I mean, we know that the biggest problem in terms of employment happens to be a lack of skills, a lack of, I'm not just suggesting everybody has to go to college. What do you expect, a professor to say? Everybody should go. I'm not saying that at all. But we've got to keep kids in school long enough, and if they don't go to college to get a trade, to get a skill, or else they're out of luck in this society.
In the literature on high-quality early learning programs, including pre-K, says for every dollar you spend, public dollar, you'll return somewhere between 7 and 17.
And you're not getting a lot of partisan distance.
No,
on this,
what I have to say is, Governor Corbett grew pre-K.
Yeah.
In a small and modest way. Governor Wolf has proposed big pre-K increases, and we're very encouraged he's going to propose another big one next week.
Yeah.
He's had really strong support from important legislative leaders like Majority Leader Reid and Appropriations Chairman Pat Brown. Pretty bipartisan.
It's not, and it should be. All right, before I let you go, this is going to be a tough state budget.
Yes.
You heard what Karen and Robert and I were chatting about.
I think the financial situation is pretty grave for Pennsylvania. What we're hopeful for is that the governor will come out next week and he'll put kids front and center in that budget. He'll make increased investments in pre-K and other early learning programs. He'll ensure that our health coverage programs have adequate resources. He'll make another step to close the adequacy gap for Pennsylvania's public schools now that we have a permanent school funding formula.
It's called the fair funding formula,
and it's fair for a good. And again, another piece of bipartisan legislation. But the realism is that kids just get older, and they miss these opportunities. They don't get a chance to go do over their childhood when the economy recovers. So what we always say to lawmakers, with due respect, is budgets are about decisions. Those decisions reflect our priorities. We hope kids are going to be the number one priority.
Yeah, we have about a minute left. Department and agency consolidation and reorganization. Good thing, but there's a big debate about this.
Well, I appreciate there's a debate, and I appreciate different points of view on it. We've had some experiences. We talked about CHIP and Medicaid recently, a few minutes ago. The CHIP program lived for 25 years in the insurance department. It moved, or 24 years. We'll celebrate our 25th CHIP anniversary in Pennsylvania this year. It moved to the Human Services Department last year. And it's a good thing. Yes, there's economies of scale.
So you're saying if they rethink these things,
they get to bring together IT systems, save resources there, deliver services to families in a more streamlined, efficient way.
I'm going to you just had the final word. And when you have any, changes take place, give me a call. We'll put you back on.
Absolutely, Terry. Thanks for having us.
My pleasure. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.